name is Norm Volsky, your host, and this is the Digital Health Heavyweights Podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights Podcast with your host, Norm Volsky. And today we are thrilled to have Rob LaHayne, CEO and founder of Leap Health. Rob, welcome to the podcast.
Thanks for having me.
Absolutely. My pleasure. So for all of our viewers and listeners that are not as familiar with Rob as I am, Rob is an experienced digital health and healthcare executive, operator, investor, and advisor who has built and managed multiple early-stage healthcare companies. Leap Health partners with large employers, brokers, consultants, TPAs, PBMs to reduce specialty drug costs and improve employee and patient experience. Prior to Leap Health, Rob was the founder and CEO of TouchCare. He was also the VP of Namely Benefits. Rob is also an advisor at Budgie Health, Benny, Redesign Health, and Primary Venture Partners, as well as board of directors at Move This World. Super excited to have you on the podcast and talk all things healthcare.
Thanks for having me. I'm looking forward to it.
Absolutely. So, you're a long-term healthcare guy. What inspired you to enter the healthcare field originally?
Yeah, I wish I could tell you I was inspired, but I got hired into healthcare was really my journey. So I assume, like a lot of people, right? I was interviewing after college, and I got hired by an insurance carrier, and that was my journey into healthcare. I think I've stuck with healthcare. It's one of the rare fields I feel like that you can have a mission-driven company that does good for people and patients and employers and sort of the broad spectrum of what we ultimately touch, or at least what I do in my career, while also building, a big company that's important and doing important work. So I think it's just one of those rare scenarios where you can, have an impact both on individual patient lives as well as the greater sort of public health or public good, while simultaneously, doing something interesting and building a big company.
Yeah, it's a great space. So those of us that found it by accident, we feel very fortunate. The people that intentionally joined it, are glad they made that decision as well. Walk us through.
My mom always wanted me to be a doctor, but I ironically, for a guy who runs an infusion company, I faint sometimes when I get blood drawn. So it wasn't happening.
That's happened to me as well. So no shame in that. Walk us through your experience as the VP of Namely Benefits.
Yeah, Namely was a phenomenal experience. I mean, great company, great people, which was really the biggest differentiator for any company, in my opinion. But Namely was my first jump into the startup world. So I joined Namely super early on, got introduced to Matt Straz, who's a fantastic founder, CEO of both Namely and a company called Benny now. Through a buddy of mine who I went to college with, who was their VP of sales. And I joined early on to help build a good old fashioned insurance brokerage operation or insurance operation within what was a really fast paced, growing tech company. So really my first jump into the startup world was an awesome experience. It was an awesome experience kind of blending a traditional services business with the, sort of the elements of a high growth, disruptive SaaS product, and bringing those two worlds together to provide a really differentiated experience for people. So it was an awesome experience.
So you grew their benefits business from about, zero in revenue to over 10 million. What was that like? And, how did you, build something from pretty much scratch?
Yeah, it was a journey. I mean, when I joined Namely, like I said, we were pretty early on, and then over the subsequent, I'm not even sure what the timeline was, but call it 12 to 18 months, we had sort of this hockey stick growth, a combination of great, sort of a great sales team and a great product and great marketing strategy, et cetera. And then we introduced the benefits offering, which just really rounded things out and helped to accelerate the growth, quite frankly. I mean, it took our average client from a revenue standpoint and nearly doubled it when we were able to get the benefits as well. So it was a great a great offering that, like I said, could supplement what we were doing on the software side. And it was a really fun journey. I mean, we were able to go out and raise a couple $100 million off of that, and kind of went through the journey of what it was like to be a part of a company that went from, I don't know, there was probably 15 or 20 of us in a tiny little office, hammering out phone calls directly to employers to like, building out multiple offices in New York and San Francisco and Austin, and going from that small team to like 650 people seemingly overnight, right? And it was just an incredible run and a lot of fun, a really great team that just worked hard and got after it. And everybody was sort of, close at that point in time. Everybody was in the office. It was a
Yeah.
different time for sure, but it was, it was just an amazing experience.
Yeah. Over my career, I've probably advised, tens of thousands and probably placed over 1,000, different executives over the years. And whenever I ask people like about what's the most fun they've ever had, it's usually exactly as you described. Like, hey, I was there in the beginning. We built it from practically nothing. We created a really compelling, go to market strategy, and we executed well on it, and we were winning and we were growing quickly. Like, all of those things are just such fun experiences. And although it's a lot of hard work and there are probably some sleepless nights and a lot of stress, like when you really look back on it, it's some of the most fun, people have is in the, high growth environment. So it's really nice to see. What would you say are the primary misconceptions about the benefits ecosystem? Because you've seen it from almost every angle at this point.
I think there's a lot. I think it's really easy, especially from an investor or an outsider perspective, to look at this space, specifically the employer or the TPA or even the payer space, and see the opportunity, right? You got 170 million or so people who get their insurance through their employer in this country. So there's a big opportunity there, and there's a lot of problems, and there's a lot of things that contribute to waste and abuse, and there's just too much fat in the system, et cetera. So there's a lot of areas of disruption that you can sort of conceptualize, but execution's tough, right? There's a lot of different solutions that want to sell into this space, and it's not a space historically that's known for being, rapidly moving or advancing in any sort of way. And so,
Tends to be a very risk averse buyer and buying cycle.
yeah, well, you need proof of concept, and you need a product that actually delivers, and you need to establish all those things, which is tough without clients, right? And so, how do you get the clients? And that takes a real strategy, and it takes a great product market fit and all those things. But just how hard that is, I think gets lost on people. It's like I said, on paper, it's always a huge opportunity to move into the employee benefits space or that ecosystem and create a product that sells there. But execution is not as easy as it seems. And just because you have a great relationship with somebody doesn't mean that it's gonna happen. And so you really need to know the inner workings of the system, and you really need to know how to create value for multiple stakeholders across that ecosystem in order to get the distribution necessary to develop proof of concept to then continue growing. So I just think that's the biggest misconception is, and a lot of companies in defense of healthcare and digital health,
Yeah.
a lot of awesome ideas are started by doctors
Hmm.
or dentist or whatever, right? And you see the problem in the system, and you can create a really great solution to go out and disrupt that problem. But if you don't know how to make it fit in the greater ecosystem, then it can be really hard to get that distribution once again. And so I just think that that's probably the biggest misconception, is just how easy it is.
I've said it many times on this podcast. I've said it probably hundreds of times in my life. The employer space is not for the faint of heart. It is definitely a challenge, but if you come in and have a great strategy and you execute on it, it can be an incredible way to get economies of scale and really make the change you want, for the healthcare system. What would be your advice to any founders that have a great idea, have built a product or a service that they think, is a great value to the employer, or the benefits community? How do you get those first couple customers, those first couple believers, those first handful of ideally, your reference accounts?
Yeah, well, I think first and foremost, it starts with de-risking product market fit to some degree, right? And the only way that I know to do that is to go out and talk to as many people as you can in and around the ecosystem and understand, hey, is this actually a problem or a pain point? If you're an outsider coming in, if you're an insider, you might already have that established. But if you're an outsider coming in, talk to insurance brokers or consultants, talk to HR directors and benefits administrators at large companies or whatever size company you're targeting. Talk to people who have worked on the payer side and just get as many different opinions on that as possible and sort of pressure test that concept against where you're seeing the opportunity. Because most people will be pretty honest with you. And even if it sounds like a great idea, you've got to figure out how to fit it in once again. And all of those things are potential distribution channels, but they're also potential blockers to you being able to do that and actually execute. So that would be my biggest piece of advice, is just really, really get sound around what that product market fit looks like and what that MVP product is that you can bring to the market and find a customer willing to pay for. Right. And then the hard part is finding those customers. And that's just about bringing value and being willing to tap into the different channels and networks that you can and be present and have those conversations with potential prospects. Just understand where the opportunity is and identify where you can bring value. And if you focus on bringing value and solving problems for people, there's a lot of problems to be solved here.
There sure
You're going
are.
to find somebody, you're going to find somebody who's had enough of a pain point with that says, oh yeah, that would be awesome. And then you just need to latch on to those early adopter customers and really use them as your product evangelists and advocates to help you grow.
Yeah, I would argue, as like a CEO and founder, your time is your greatest asset. Like you are, a great resource for the company and you got to use those resources really, smartly and effectively. So, a lot of what some companies struggle with is knowing which companies, and customers to chase and be able to identify which potential customers might be great a year or two into the growth, but are probably not going to be early adopters. Like, how do you evaluate like who are the right customers to go after as your first? How do you know if someone's risk tolerant? Do you follow other vendors who have similar value props as a way to like efficiently use your time to prospect? Like, what do you do strategically to identify like which customers are the ones that are most likely to be the early adopters versus the ones that maybe follow on 2, 3, 4 years later?
It's a great question. I don't know if I have the perfect answer. And anybody who does probably spend a lot of time at McKinsey or something. But
I would have liked to see the McKinsey people actually do it and execute on it as opposed to just theorize on it. But
I got to be careful. My co-founder worked at McKinsey, so yeah.
Well, I'm a big fan of Hani. He's also definitely done some executing himself. He's the exception, not the rule.
My take on that is one thing that I've learned is to be really open-minded. Like with Leap, we started this company. It's a product solution built for the enterprise employer space.
Mm-hmm.
If I'd have told you who our first customers would be, it would be XYZ large employer with 10,000 or more employees that understands this, this problem as a part of their healthcare spend. And our first 5 customers have all been TPAs, right?
Yep.
And so I think you need to be opportunistic and keep your sort of eyes open to being flexible in terms of like what that ICP looks like, and keep a mind towards, hey, this is what we're building towards and this is what we're working towards, but be open-minded to the fact that that first customer might not be that ICP and that best customer might not be that ICP in the future, right? I mean, it can, there's so many different twists and turns in a business in this phase. And, to your earlier point, like some people have a lot of fun with this and really love this and kind of love operating in the murkiness of what an early stage company is. And like, that's what gets me fired up, is kind of doing deals and figuring out what product market fit is and going out and executing and maybe pivoting and being flexible in that regard. But I think that that's really important, is just to be open-minded about don't have tunnel vision into like what that ICP is, because it might change. And then when you get those opportunities, make it work. Right. I mean, there's so many opportunities, like I said, to provide value. And for us, like the way you can think about it is always, whether you're going from a solution that wants to sell into the enterprise space, but recognizing that's a 18 to 24, if not longer, month sales cycle. So you win a bunch of mid-market deals in between while you continue to build that pipeline in the enterprise space. Or maybe it's, hey, we want to sell to enterprise employers. TPAs have proven to be this great channel for us that we're gonna work while we continue to build that pipeline, right? Just different examples of that across the spectrum of like where you ultimately want to get. And and ultimately it's just developing that plan. It's like, hey, 2025 is going to look like this. We're going to target these guys. We're going to build the pipeline on this side, and by 2027, we want to be selling into payers, right? And you just need to build that plan and go out and execute on it, but be flexible.
Yep. So after your time at Namely, you led TouchCare. It was a private equity turnaround. You led the company through change in product, relocation, capital raise, rebrand. Recruiting a awesome team. Ultimately, you had a successful pivot. What were your greatest successes over at TouchCare?
I think TouchCare for me personally, was just a phenomenal learning experience. I mean, it was just going from that venture backed sort of rocket ship type of experience to a private equity owned business that was a full blown turnaround, right? We had zero revenue. We were running out of cash and we needed to pivot and launch a new business. That was just a phenomenal learning experience and just operating a business in a bit of a different way, right? Just more of a focus on profitability, less focus on top line growth, things like that. But the most important thing that we did, I mean, was just hired a great team, right? I mean, right? It was just about,
Simpler when you have the right chess pieces.
yeah, and it's about, and it's not necessarily about domain expertise or the person who's done it before or whatever. It's about finding the people that are committed to solving the problem,
Hmm.
willing to roll up their sleeves and like get in the trenches with you and do it. And that was what we did a really great job of at TouchCare. The first handful of people that I hired at TouchCare were with me for the entirety of my journey there, and they're still
Wow.
there. And they
What a
were an amazing team and amazing people. And yeah, and they're still running that company. On year 4, my leadership team and the people around me were the same VP of sales, same head of client services, same head of operations, same head of marketing, all of that. It was the same team that had been there since day one, right? And I think that was really rare. And so I think just the team was the biggest success story there. Was that we just were able to go out and recruit a great team that was willing to come in and help us build this thing. And yeah, that was.
What were your greatest learnings? You mentioned that like working for a PE backed company and learning, some of the way to run and operate a business at that level and scale made you a better executive. Like how and, what were your greatest learnings?
I think mostly on like the financial discipline side of things, right? It was just a different mindset in terms of how you finance a business, and what we were ultimately looking to do in terms of value creation for our investors. And so being able to, I think now the state of the venture world, I think that venture capitalists are focused on value. Obviously you're looking for top line growth and you want that rocket ship experience and you want to find those companies that are going to be the next Uber. But at the end of the day, most companies don't do that. So how do you have that opportunity, but also create a company that's going to be lasting and create value, not just for your investors, but for your customers, for your patients, et cetera? And so I think there's been a bit of a mindset shift in terms of value creation. And I'd say that my experience at TouchCare led me to think about business on both sides, right? Not just the top line growth, but also on the value creation side, really, really for all the interested parties. So that was probably the biggest learning there. That and honestly, one of the things too there was just success in one specific market doesn't equal success anywhere else, right? And so what we tried to do, the biggest mistake I think we made was we're having a lot of success in New York. We're a New York company, had a fantastic team in New York, and we were doing great work and we were growing. And we thought, all right, great, now we just need to hire somebody in Ohio and hire somebody in California and hire somebody in these other markets and it'll repeat itself. And we weren't ready for that. And I had one of my advisors and one of my investors said, we made this, drawing on his own experience, made this mistake 30 years ago. And he said, you need to pull back and just dominate where you are, right? New York is a big enough market to build a really big company. Dominate New York and then get out, and you'll have your opportunities, and naturally those will come to you. And that was really some great advice that I got in that moment. And we followed that, and it was a real inflection point for the company, honestly.
Yeah, that's really, really good advice. You sitting as an advisor at Budgie Health as well as Benny. What's your philosophy when it comes to advising companies, on growth?
Yeah, for me, it's like, where, back to value creation, like, where can I create value, right? Like, is it an introduction? Is it a let's get together and have a coffee and talk through like something that you're working with? Is it helping you hire somebody, or tapping you into a great employee? It's just a matter of like, where can I provide value, and using my network or my skill set or my previous experience to give that advice. So it's just about, being a resource, and somebody who can bring value to whether it's the founder or their team or whoever it is, and giving them time.
Yeah, no, I think there's a huge misconception when it comes to like advisor and board work. I talk to people about their careers all day, every day. And there are so many VP, SVP level, C level folks who just call me and say, "Hey, Norm, I want to, pick your brain on something. I think I'm at the point in my career where I should start advising companies. And, can you start keeping me in mind for those things?" I say, "Sure. Like, absolutely. We work on those a lot. What are you willing to sacrifice for it?" And they're like, what do you mean?" It's like, "Well, like, what are your expectations? Like, what do you think being an advisor is all about?" It's like, "Oh, well, you just kind of, take a call from now and then, and, you give some advice, and that's about it." I'm like, "No, like, you got to be willing to do anything. You got to be willing to be the janitor if asked. Like, it's really just allowing yourself to be completely vulnerable, rolling up your sleeves, doing things you might not even do in your current role, but you're asked to do it, on behalf of an executive that's starting a business. And it's like a huge undertaking. It's a lot of your time, it's a lot of your, you know, thought process and effort. And, it's a big deal. It's not just like something you put on your resume and show up to a board meeting once every 3 months. Like, there's daily, weekly tasks that you're asked to do, and if you're, not willing, or you don't have the time to do it because you're so busy in your operating job, like, that's fine. But like, this is not just like a small couple hour commitment a quarter thing. Like, this is, something that is going to be super cumbersome. And most times people are like, "Oh, well, let me wait till I'm not working full time to do those things." I'm like, probably a good idea, unless you don't want to spend much time on weekends relaxing, or, mornings and nights. Like, it's another like job. It's not just a, you
Well,
know,
and it can flow, right? It can ebb and flow, and it's just a matter of, what are you willing to do, right? It's kind of, it's like, if George or Matt from Benny or Budgie called me and asked me for a favor, there's a really good chance I'm going to try to figure out how to do that for them, right? Whether it's an introduction or sitting down with the head of sales or the head of product, and like, going through a roadmap, and trying to help them out. Like, it's just being available and trying to bring value. But if you're not willing to do it, and if you're going to blow the email off, or you're not going to send the email, or you're not going to like follow up with the person that they want an intro to, or whatever, that, yeah, it's, it might not be right for you.
yeah, there's a lot of commercial executives. They're like, "I'm happy to advise, but like, I'm not going to open up my network." It's like, I guarantee the
Probably
CEOs.
the most valuable thing.
Yeah. So, it's kind of funny how that works. What has it been like advising at Redesign Health?
Yeah, redesign. I did a stint of consulting work for about 18 months between TouchCare and Leap, and did a couple of projects with the redesign folks, and great team over there. I mean, honestly, they're working on solving problems in healthcare as they see them, and they've got a great sort of advisory network that they pull from, and a team of analysts that are doing the research on where the opportunity is, and then they go through a really thorough process of like kind of pressure testing that business in that network. And
Mhm.
otherwise. And I was fortunate enough to help out with the launch, like from IDEO all the way to launch on one company, which was a really fun process to be a part of. And once again, it's just about like how can I provide value to you guys, right? Like whether that's just going through the financial model or the revenue model, or trying to make some introductions where I can, or inflecting my quote unquote wisdom on what you're thinking about from a commercial standpoint or a product standpoint, et cetera. But yeah, they're a fun group to work with.
Well, for all of our viewers and listeners that are early career and you have career aspirations and you're wondering, like, how do I get there? Like, how do I get to the next level? What Rob just shared is like super crucial. Like, please, like, hang on to this, think about it, really look yourself in the mirror and ask yourself how often you do this. He said, in every scenario, whether it's being an officer of a company, being an advisor, whatever, how do I bring value? If you ask yourself that question every single day, every single hour, every single minute, and you're like, hey, how am I bringing value to the people I'm working with day to day? If you don't know how to answer that question, you're probably not bringing much value. If you are bringing some, you can always, bring more. So I think that's a really good way to always make sure that like you're advancing in your career, because if you stop bringing value, then your career is going to stagnate. So I think that's a really, really good way of looking about it. And, it's what made you and has made you and will make you continue to be, super successful, Rob. So really glad you shared that. What inspired you and your co-founder to start Leap?
We saw a big, like most things, we saw a big, I don't know if I call it a problem, but we saw an interesting dynamic in
The
healthcare.
gap in the market.
Yeah, we saw an interesting dynamic where there was a like so many things in healthcare, there was a dynamic that existed with infusion and medically injected drugs, which is what we deal with, and the way that they're bought and sold in the market, and ultimately what that means for employers who are the ones paying the bill back to 170 million Americans getting their insurance through their employer, right? And so we just got really interested in this problem and did market research on how this ultimately affects employers. And we went out and we bought a giant database worth of claims data. And we ran a bunch of tests against it and tried to figure out, hey, can we create a business here that
Mhm.
creates value once again for employers specifically? We knew we wanted to be in the employer space, and that's where my background is, that focuses on this, sort of slice of the market, if you will. And that was it, right? And it's kind of one of these businesses where, back to, why do you stay in healthcare and why do you stay with, where we believe we can create value to the employer or the plan sponsor or the payer, the one paying the bills here. And we can have a really dramatic impact on the patient's life, right? Both from a convenience perspective, from an experience perspective, from an outcomes perspective. And we had that conviction. And so, same thing, right? I went out and I talked to a ton of people in my network and said, hey, how are you thinking about this problem specific to the employer space? Is it even a problem? Is it something on your radar? And emphatically, everybody I spoke to was like, yes. And we don't have an answer for it, right? We don't have a solution there yet. We've talked about it. We've thought about it. We understand there's a problem there, but we don't have a solution yet. And so that was really what inspired us to launch the company.
That's fantastic. Ever since I met you, I've been asking people in my social circles who I know like get infusions, whether it's for Crohn's ulcerative colitis, whether it's cancer survivors. Like there's so many different types of patients that need biologics that are, provided by infusion. So can you educate the listeners and viewers that don't know as much about the infusion market, just how many like types of patients with different conditions and issues that go to infusion centers, and like just how many people this truly impacts?
Yeah. Yeah. So in terms of the number of people that it impacts, you're probably looking at 2 to 4% of any population, right? So, a very small sliver of the overall population on any sort of infusion drug. However, those patients are driving 50 to 65% of your specialty drug costs, right? And your specialty drug cost is going to make up, let's call it 50 to 65% of your overall pharmacy cost. So you're looking at, somewhere between 10 to 15% of your overall cost being driven by specialty. the vast majority of that being driven by not people on GLP-1s and not people on Humira and some of these like, kind of brand name in the news drugs, but on infusion drugs, because these drugs oftentimes cost $25 to $75,000 per dose, and you're chronic, right? So you're getting it anywhere from 2 to 52 times per year. So if you really drill down into it and are willing to kind of go through that process of double clicking into pharmacy, double clicking into specialty, and seeing what's driving it, you can be really targeted in your approach, which I think is a huge value prop for us. In terms of the conditions, because I think in healthcare, we like to categorize things, right? It's like, what's our MSK spend? What's our cancer spend? What's our, diabetes spend, et cetera. Infusion's interesting because it touches a lot of these categories, right? And a lot of what drives your cancer spend is the abuse that happens on infusion drugs that are being infused in a cancer center, at an academic cancer center. Now, plenty of patients need to stay in those academic cancer centers. So we're not saying that this is right for everybody, but there's plenty of patients that could be just receiving these infusions in the home. Mm-hmm. And by doing so, you could create hundreds of thousands, if not millions of dollars of savings on just a few patients. And so there's just a big opportunity there if you're willing to go through that process of really double clicking. And then, because of the dynamic of touching a lot of different categories and a lot of different drugs coming to market over the next 5 to 10 years, right? They're expecting anywhere from 10 to 20 new infusion drugs per year to come out via FDA. You're just looking at a problem that's getting bigger and bigger and becoming a bigger piece of each category, right? So it's no longer just your cancer patients and your Medicare population, right? You got drugs that we administer where the average age is like 26 years old, right? It's people with Crohn's and colitis and dermatological issues and MS and osteoporosis, and some of these drugs that touch MSK or touch cancer or touch your gastro spend, et cetera. They are really what's driving a lot of that spend, and there's an opportunity to create savings across those different categories.
Yeah, like I think a lot of people just assume like, hey, infusion, like cancer, chemo, like that's what they're thinking. There's so many other people with different conditions that are not cancer related that really need this level of care. And, you guys are doing it not only more efficiently and a lot more conveniently for the patient, but a hell of a lot more cost effectively as well. Kind of walk us through, just why patients love using Leap.
Yeah, I think first and foremost, there's a convenience factor, right? The demographic that we serve in the employer market is people like you and me, right? I mean, I've got 3 little kids. My wife's an entrepreneur. I live in the lower Hudson Valley of New York. If I needed infusion care on a regular basis, it's an hour-plus trip into Manhattan, most likely. I don't think there's any infusion centers around me. It's inconvenient. It's time away from my family or time away from my work because those infusion centers are open at the same time.
And by you making it so much easier, it also increases adherence.
Correct. Right. And so the number one cause of treatment failure in infusion is lack of adherence. The number one reason for lack of adherence is lack of convenience, right? I mean, it's disruptive to a patient's life. And so by bringing the care to the patient, we improve that experience by A, making it more convenient, B, being able to administer the drug at a more convenient time, right? So after hours or on the weekends or whatever it is. And that creates better adherence and a happier, more viable employee who's not disrupting their productivity. Like you and I, I'm in my basement right now. Looks like you're in an office or potentially in your house. But
office.
Yeah. And so I have more flexibility than somebody who's, working on a manufacturing line, right? Mm-hmm. Or a teacher or somebody like that who doesn't have the time to just go do this during their workday and make up those hours at night or something like that. And so there's a real convenience factor to it and comfort factor. And the dynamic in the US right now is we've got about 90 to 95% of infusions are administered either in the hospital or in an infusion center. Right. And those are great options for plenty of patients, but there's plenty of patients that have no reason to be going through that inconvenience and should be receiving their care in the home. And so at Leap, we try to provide options.
Leap patients are administered in the home, and how many are administered at a infusion center?
Yeah, the majority are administered in the home. However, we do have a network of infusion centers that we refer folks into. And those infusion centers in our network are actually operating in a different model. So we work directly with the infusion center to eliminate the margin once again and have them operate on a fee basis. And that's a big differentiator for our patients, once again, not necessarily because of their experience, but because of the employer who's paying the bill, right? We're eliminating the margin. We make it more transparent for them. We make it more of a fee-based operation.
And who is administering the infusions? Like, is this a nurse? Is this a, technician? Like, how are they trained?
Yeah, no, they're all nurses that we work with and contract directly with. We've got about 10,000 nurses in all 50 states. A lot of the nurses that do home infusion are actually full-time nurses working in a hospital, 3 shifts a week and then picking up 1 or 2 days doing home infusions. It is a specific nurse that you need to find. They all go through a very strict vetting process with our nurse and chief medical officer, our lead nurse and our chief medical officer. And so, there's strict protocols that they adhere to and we have on our end in terms of who we contract with. But yeah, they're all nurses that are actually going out into the home and administering.
And on average, give or take, how much percentage are you saving the employer per employee that utilizes the service?
It varies by drug,
Mhm.
location, and whether they're coming from an infusion center or a hospital or another home infusion provider, because we usually provide savings over that as well. But on average, you're probably looking at somewhere between 40 to 60% savings on the claim on the drug.
That is a ton. I'm not going to share who because I don't want to get this person in trouble. But, someone in my family had employees that had some issues that required infusion. And she told me, like, hey, like, there's an employee of mine that was over $1 million a year in infusion costs because of, certain conditions. And that was mind blowing to me. Like, I've heard of like $1 million cancer treatments, $1 million NICU stays, but when we're talking about a actual infusion patient, and that's not like a one-time expense, that's an annual expense. So like if you can just get a couple of the highest cost members, and you're saving 40 to 60%, like you're saving hundreds of thousands of dollars per person. And, like, if that person stays at the company, you're saving millions of dollars if that one person utilizes the service,
Yeah,
let alone doing it at scale.
we have patients that hemophilia patients that need an infusion every week, right? 52 times per year, and on certain drugs, depending on once again the location and the facility, we can create savings from as low as like we'll call it $150,000 a year for that patient, all the way up to like 1.2, $1.3 million a year margin that plan sponsor is paying for that drug, right? And so by eliminating that margin and by driving to the lower cost price and creating a transparent model for the employer, we create that savings. And then for those patients, their experience is just so much better. It's like not a weekly trip to the hospital. It's a weekly visit from a nurse, and you do this on your couch, right?
Yeah. For everyone who watches this podcast or listens to it fairly regularly, first off, have a few more things to do in your personal life. But second, I do appreciate you joining us. I am a huge fan of direct contracting. I think that is the future in the employer market. We've seen the fertility space leverage this type of model. We've seen the, cancer treatment and surgery specialty surgery market really, leverage this model. Now we're seeing, companies like yours, Rob, at Leap, and companies like One Imaging on the radiology side that are starting to carve out other specialties that can be disrupted by this model. I love it. But what is so hard for some people to understand, whether it be employee, whether it be benefits leader, benefits consultant, is so many people think, well, if it's cheaper, it has to be worse. But that's the furthest from the truth. All these companies, not only are they providing these services at significantly lower costs, on the low end, 40% in some models, on the high end, 80%, and then everything kind of in between those general, guardrails. Also, I know that Leap and all those other companies like also provide the highest quality of care at the lower pricing. Can you explain how you're able to achieve that? Because it's so counterintuitive to the normal consumer that, like, in the US, you tend to think cost and quality go hand in hand. in the healthcare system couldn't be further from the truth.
Yeah, I think it all gets back to just the way that goods and services are bought and sold in our healthcare system, right? And the entire healthcare system is stood up on a model where infusion drugs, for example, right? They go through the same negotiating process as an MRI, right? You mentioned the imaging concept, right? And a lot of what I used to do in our old company was care redirection into imaging facilities outside of the hospital. Right? It's a $2,500 charge at the hospital. It's a $200 charge using the same equipment directly across the street at the imaging center. And infusion care, because it's billed through the medical plan, goes through that same process of negotiating a reimbursed rate with the carrier on what that procedure is, which is administering the drug. And so that margin can be anywhere from, in the hospital, 150 to 5, 6, 700%. In an infusion center, it can be a whole lot less, but it's still built on the backs of creating margin on these drugs. And so I would argue that in a lot of cases, your experience and your care at an infusion center might be way better than it would be in the hospital, right? That's impersonal. You're risking co-infection. You're sitting with a nurse who's managing 4 different patients. You got a waiting room. Like it's a terrible experience for a patient with a chronic condition who needs to just go get a 2-hour infusion every couple of weeks.
And yeah, like every couple of weeks. So it's not like, oh, you got to wait in the waiting room once
No,
a year.
it's
This
over
is
and over
like
again.
a lot of productivity, a lot of time wasted that they could be spending at work and on their career, or at the very least with their family and relaxing and not getting more frustrated. So it's so impactful for the patient, not only from a clinical quality standpoint, but from a convenience, from a time saving. Like this is something that patients truly appreciate. And oh, by the way, it's cheaper for the employers. Like there's literally no logical reason for companies not to use this eventually.
Yeah, and just to continue on that line, right? I mean, like the patient experience is just better, right? I know you told me that the folks over at Uptiv, right? And like they've created a fantastic patient experience in their centers, right? So why would a patient working with great nurses at Uptiv have a comfortable chair to sit in with a TV and water brought to them, et cetera? It's a way better experience than you get in the hospital. You can't tell me that the hospital is giving them any sort of a better experience, right? So that patient absolutely should go there. And we're just another option on that spectrum, right? So home care or an infusion center is just, in a lot of cases, a better option than the hospital from a patient experience standpoint and from, ultimately from an outcome standpoint, because that's what it ultimately bubbles up to.
Hey, whenever you can get care delivered inside your home and you don't have to leave, adherence is going to spike. Like I saw that with Hinge, when I worked with Hinge in the very early years, when it was just a concept and I was literally educating the market that these solutions existed. People are like, well, are people really going to get their PT done on an iPad? It's like, yeah, like they're going to do it because they don't have to drive an hour there, an hour back, get very impersonal service, spend a lot of time in a car, like when they're traveling and they're, in their hotel room or they're at work and they have some time to kill, like they can do their PT when it's convenient for them and, do it on their terms. And ultimately that concept did pretty well. And now I just see all these new, concepts popping up where it's like, hey, how can we bring care delivery outside of the 4 walls of a hospital and ideally into the patient's home or in, a place they spend a lot of their time, willingly, which is great. So Leap also eliminates, provider margin on expensive specialty drugs, creating millions of savings for the plan sponsor. Like, how do you reduce the cost of the drug itself?
Yeah, so there's two things there, right? So, think of us, the easiest concept to understand is just like Mark Cuban's model, right? It's cost plus, right? So I'll show you exactly what that drug costs, and that's what you're going to pay. Plus, you're going to pay for the service of administering the drug, which you pay for anyways, right? This is utilizing the exact same codes that you're currently being billed through your medical plan. And our model is just different in that we haven't been stood up on needing the margin in order to operate the business. We've stood up a business with no margin attached, right? So for us, we just negotiate our fee based on what can build a business for us. And we're volume driven. We're not drug price driven, right? So I want to see more patients, not expensive patients only. And so that's how we do it. And then we manage on our end multiple sources for the drugs themselves. So we have multiple specialty pharmacies that we work with. We have some dropship wholesalers. We have a few programs that we can leverage through 340B and international and things like that, so that I'm driving to the lowest price possible on each patient for each drug. And where that becomes really relevant is if your PBM or your health plan have a preferred specialty pharmacy relationship, which CVS or Optum or Credo through Cigna, right? Like they all have one. Then you're getting the best price from that one source. But I've got some of those folks in my network, and they might be the best price for Ocrevus, but they might be 400% higher than one of my other partners on Remicade. So I'm going to go to them for the Ocrevus. I'm going to go to the other providers for the Remicade. And so that we're driving not just to a transparent pass through, but we're going to the lowest cost possible as well. So you get a bit of a marketplace effect combined with a transparent pass through on the drug itself.
Yeah, it's like you're going to the farmer's market. You're not going to Costco. You get a couple things from each as opposed to going to one source only, and you're getting some good deals and getting ripped off on it. So I love that. What's in store over the next 5 years for Leap? What will we be looking back on 5 years from now, and like, what did you accomplish?
Yeah, back to value creation, right? So as we think about our goals, number one, obviously, is to work with as many addressable lives as possible, right? As many employees are eligible for our service as possible. Now, within that employee population, you've only got a small number that would ever need us, but it's still a lot of people, right? It's still 4 million people a year.
And it's super motivated people. Like, I just want to be very clear. I've talked to multiple people who have had infusions themselves as patients, many dozens, maybe hundreds of times. And they've described to me the horror stories of a hospital site versus a very well run private practice site, let alone like home infusion, which is obviously the most popular.
Yeah.
And what is preferred across the board by patients. So if you are spending hours waiting a month or even a week, on going to some of these centers, like these are people that will utilize the service, that will opt in, because it's a huge pain point for the patient. So I think a lot of things, that benefits leaders worry about is, okay, if we, go live with this, who's actually going to use it? Are we going to get utilization? I would venture to guess that your utilization rates in the population that you're trying to interact with are probably higher than just about any other digital health solution out there.
Yeah, absolutely. And as we evolve, it's about how can we have a unique position in that we see patients in the home and we have a transparent model that operates on a fee. So how can we bring more services to that patient during that encounter that create value for the plan, right? Is that a virtual primary care visit while we're sitting there with the patient doing their infusion? Is that, some other type of service where, there's a cost driver for the employer that we can leverage that position as a home care provider and as a recognized, trusted resource to that patient and other patients that maybe we're not meeting with now, to deliver care and bring care to them in a more convenient way.
I'm excited to see, what you got up your sleeves. Really excited to see, what new capabilities Leap has over the coming years. I ask everyone who comes on this podcast,
Yeah.
You're a CEO, you're an investor, you live, breathe, sleep healthcare. You have for a long time. I do as well. How do you practice what you preach? In a very stressful job, you got a lot of responsibility. How do you stay healthy mentally and physically, to be able to do this great work, for so many people
Yeah.
in need?
I'm a bit of an exercise fanatic. I exercise every day, usually at 5 o'clock in the morning before my kids wake up. But yeah, I ride bikes. I do triathlons. I live in an area where it's a lot of great hiking and trail running and things like that. So I try to stay super active in that regard, and that's just, for me, it's as much about my physical health as it is about my mental health. Like on days that I don't work out, I feel less sharp. I feel more sluggish. I'm not as creative. I mean, that's where my ideas come. That's where my breakthroughs come. It's mile 25 on a bike ride or something that you have that breakthrough oftentimes. And that for me, I like pulling over on the side of the road and emailing myself or something like that. And that's, for me, that's integral into my life.
Completely agree. I'm not up to your fitness regimen, but I try to, get on the Peloton every day and maybe get, a lift in or, rowing machine or something to
Yeah.
get the blood pumping. I definitely, do better, think more clearly when I do. And then, the other thing that I think is a huge determining factor of someone's health is what they're putting in their bodies. So in a stressful job, what do, you and your family to make healthy meals at home so that, you're putting, really, really quality food into your body and, giving yourself, some great fuel to allow yourself to do your best work.
Unfortunately, I'm the house cook.
Myself as well. We're a very progressive household.
Yeah. My wife does no cooking, but she likes my cooking, so we don't order out much either.
Yeah.
So for me, man, I try to keep it simple, right? Like it's a protein and a vegetable, and a lot of fish, a lot of chicken, a lot of things that my kids complain that I cook, and then they eventually eat because they're hungry. But trying to just try to keep it healthy and focus on making sure we get the basics and eat well here.
Sounds like healthy meals might be one of the things that your nurses should deliver
Yeah,
alongside.
exactly.
As long as people are waiting a couple hours, with the infusion, maybe give them something good to eat, something
Exactly.
healthy. That might be something the health plan sponsors. So again, Rob, thank you so much, not only for joining
Yeah,
us on
thanks for
the
having me.
podcast, but what you and your team at Leap are doing. Really great work. Love to see it. Love to see the growth and can't wait to see additional growth going forward coming from you and your team. So thank you so much for joining on the
Thank you.
Digital Heavyweights podcast. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.